we are going to invite to the show an emergency doctor, Dr. Gary Payinda, to talk about the demotion of Reti, the application of the Brown, don't know if that's right or not, to the health syllabus, the health portfolio. Gary, thanks for joining us tonight.
Happy to be here, Pat. Thanks for having me.
Question that I posed on Sunday morning, because rumors were that Dr. Shane Reti was going, and I started wondering why. We spoke last night with Luxon being very, very, very clear that he wanted people to know that he hadn't lost confidence in Dr. Reti, so he wasn't underperforming. And so therefore he wasn't underperforming, but he was moved on. And we had another theory, which is, has Dr. Reti got to a position where he is so, the policies that this government's putting in, he maybe can't, did he ask to be pushed? And I wonder, did you have any insights or any thoughts as to why he left or was moved on?
No, I don't have any insights. It would just be conjecture at this point. I mean, I think there's a lot of anger in the community from patients and from doctors and nurses. And maybe that's reflected in bad polling numbers for national. Maybe they decided to just change things up. Maybe they need to make more harsh austerity cuts, and they just need to get a fresh face in there, like a fall guy, to do even more damage. I mean, maybe Shane did the first part of the damage, maybe the first third, and they need someone to progress the second stage. I mean, my prediction would be that in the third year, that's when you start seeing gifts being dangled, carrots being dangled, and that's when you might see them get a little bit nicer to places that they need the vote. Not Northland, because it traditionally votes national, but other places. And maybe you'll see a little bit less meanness and austerity, but I wouldn't guarantee that. So no, I don't really have any insights. For me, Pat, it doesn't matter which arsonist is burning down the house. Yeah. It doesn't matter what mask they have on or what sound bites they generate. Judge them not by their actions, not by their supposed reputation as a doctor, 20 years ago. Judge them by what they actually do. And I mean, if you use that metric of actual deeds, not words, you would see that Dr. Reti, and I'm charitable in calling him that, has done some truly horrendous things against the public health, whether it's supporting tobacco sales or tax cuts, $216 million to help Philip Morris out, getting rid of the smoke-free reforms, which actually National, the last time around, was the ones who proposed it. And Shane was a supporter of reducing nicotine in cigarettes, for example. And this time, I mean, I think his ambition went way beyond him being a doctor. And he was silent when the country needed him most. And was really not just silent. I mean, he voted for these things, whether it's assault rifles, whether it's raising speed limits, which will absolutely increase the number of fatal accidents in the country. Like, he, on time after time after time, he's been given the chance to be a public health advocate. The guy worked in informatics for a while. He did a lot of things, I think, to get out of being a GP. He was a dermatologist for a while. He was informatics for ages. But if anyone should understand how important it is to have good data and IT, it should be a doctor. But yet he was an integral part of slashing the data and IT jobs by 47%. That is destructive on a scale like we've never seen before, right? They've eliminated 9,000 public sector jobs. They really have gutted things. And like people in IT, for example, are saying, like, how could you have done this? We desperately needed a total refurbishment of our IT services. If you come in to me as a patient, I can't even access your medical data. Like, you might as well be from another country. No, our systems don't talk. So if you're outside my little region and you come to me in the middle of the night with a serious emergency, I don't have access to it. Even if you're just in town and you lived in my town, I couldn't access your GP notes. It's wild how badly we needed these things. And Shane knew it. And yet he voted or was integral in gutting service after service after service, including cutting, as I said, 47% of computer IT jobs in health. That's suicide. It's incredibly short-sighted, and it's going to be hellishly expensive having to hire contractors to provide all of these roles later.
Having the computers not talk to each other, it just reminds me of, I mean, I was too young to do it, but elder relatives and siblings who went and did their OE in the UK in the sort of 90s, 80s and 90s, they didn't have a system where the banks talk to each other. That's 35 years ago. And so all the Kiwis would go and get their £500 out from that bank, and then they'd go to another branch and get their £500 out. Then they'd go to another branch and get their £500, and then they'd jump on the plane and come home. Didn't work out so good for them, 20 years later when they wanted to go back. But that's 35 years ago. Computers weren't talking to each other 35, 40 years ago. And you're saying our health system today is the same as that.
Yeah, I mean, the problem with your analogy is it gets even worse, because we're not talking about making an extra $500. We're talking about when you come to me sick as can be, critically ill in the ED, I can't access your chemo records. I can't find out what medicines you're on. I can't access virtually anything. Now, of course, the following day we can put in paper requests and fax things back and forth and get things photocopied and sent. But for a country as small as ours with 5 million people, it's insane the level of neglect that has been allowed to happen in healthcare. But what's different with this government is they're not even like acknowledging it. They are gaslighting as hard as they can. Like, for example, we lack literally thousands of nurses. The understaffing is bad. We have to close down beds in 100% full hospitals because there's not enough nurses to staff the beds. And this isn't just one hospital. This is, across the country in various places. And the rhetoric, it would at least be respectable if they said, things are hard and there's not enough nurses and we can't afford to hire them. And that's that. What they're saying is we have overhired nurses. You've heard this. We have overstaffed nurses. We have exceeded our expectations for how many we would hire. No. Stop lying. You've under budgeted massively. And so now what looks like a surplus is actually, a really bad deficit. And so it's the gaslighting that's getting old. And there's enough people in health now that absolutely call them out on it and knew. You've seen doctor after doctor, just before they resign or move to Australia, they will come out and be honest. They will leak the email chain. They will say, our hospital has no doctor at night. We're a doctorless hospital. I mean, when's the last time you heard of that? It's just insane. Things really have gotten worse. And yet we're being told that they're better. And it just doesn't, it doesn't add up. It's like we're living in an alternate reality. So yeah, I don't know, getting back to Shane, whether it's him or Simeon or a different arsonist does not matter. At the end of the day, the building will still be burned down. Our public services, not just health, are getting absolutely punished, gutted, defunded, destabilized. And when that happens, and this is in country after country around the world, this is a recipe. You hire consultants from the private corporations and you become friendly with the power brokers in the private world. And you start making deals with private hospitals and private clinics and private everything. And that's where we're headed. And it would be one thing if we were a rich country and we could all afford really good private health insurance. But you can rest assured that's not the case. Most people can't, and they depend on public services being there for them. And it's getting harder and harder to maintain in this austerity situation.
That picture you paint of not being able to get hold of records, like I'm just imagining it's 11 p.m. on a Saturday night. Obviously, lots of places are shut on Sunday. Someone comes in unconscious. Then what? So not only can the person not tell you, but the records can't tell you. You know who they are because you've got their driver's license. It's possible you might make the wrong decision because you're not being able to access their files.
Of course. So we end up having to duplicate and waste a lot of money. Now, realize all of these things we're talking about, these expenses, this is stuff that Mr. Luxon will call a back office, a back room cost. He keeps saying this thing. It's just like business speak, CEO talk. Oh, I'm just cutting the back room, the back office. It's no big deal. Patient care won't be affected. Public services won't be. It's all BS. Like, of course, these cuts are affecting us. When you fire, or I should say, what's the word for it? They don't call it firing. It's disestablish half of the roles in data and IT. What the heck do you think is going to happen? Yeah, it's atrocious. And it's not just data and IT. We keep railing on about that. But if you look at their support of big tobacco, it's absolutely rancid. I mean, there are so many tobacco lobbyists employed in government right now. So many close relatives of people, of powerful politicians who work for Philip Morris. People who led the campaigns, managed campaigns for New Zealand First that have moved into Philip Morris corporate gigs. That it's just dismaying. It's unfortunate. The public deserves better than this. And when they say there's no money, I just want people to be completely lucidly clear that there's tons of money for health and schools and bridges and what have you. It just went to higher priority people than my patients. It went to landlords. So if you are in the top 0.2% of landlords in the country, of property owners in the country, that means you own 50 or more units of real estate. So, I mean, think about the wealth that. So a person who has 50 units is going to get the taxpayer to help fund their mortgage insurance. Right? They can deduct mortgage insurance. If you're a single mother, if you're a first home buyer, not even people maybe struggling, but if you are any regular person, do you get the taxpayer giving you a tax break on your mortgage interest? You should, but you absolutely don't. This government has given the big bucks $16 billion in tax cuts that mostly target the wealthy. And then the $3 billion for landlords, which is just incredible. And they will couch it and they'll say there's a lot of mom and pop landlords out there, right? The majority of them turns out it's not true. Probably 2/3 of the landlords out there are not mom and pop owners. And of course, if you cared so much about the elderly person with a batch that they rent out on Airbnb or what have you, you could make a carve out. You can protect poor people. And we need a government that starts doing that, whatever side it's on, whatever party. We need a government that helps the bottom majority of the country. So you look at these tax cuts and you plug in, tonight I plugged in some numbers for someone making minimum wage or near minimum wage, and I used minimum wage, and to see how much the tax cuts would get you, the tax breaks that the government touts. $24. Okay, I think it was $24. It was like $24 a week or a fortnight. I'm not quite sure, but that was the order of like the range of it, around $20 every 1 or 2 weeks. And for that, your public hospitals are getting decimated. Your primary care is non-existent. GP services are crumbling around the country. That's why you can't get a GP appointment. That's why so many towns don't have any GPs taking new patients. It is a mess. And the ones that they immediately looked out for were the landlords. So I just have to bring it back to that. It was the wealthy. And, you know, I don't know. I don't think anyone who voted them in expected it to be this way.
No, I think you're right. We hear so often that a lot of national voters just wanted their tax break and stuff, and the other stuff they're doing. Many are saying, "Hang on, we didn't vote for this." You were talking about privatization. Well, we've been talking about it this way, that in opposition, the National Party and the right would say government can't work, look at the bureaucracy, it's bloated. And then they get into government and they make policies which fail. And then they step back and they say, see, we told you it wasn't going to work, even though they've put the policies in place to make things like the health system fail. But I'd like to know from you as well, what are the dangers that we need to know about privatization, especially in the for-profit healthcare region?
I think there's a lot of assumptions by New Zealanders about private health insurance, about how good it is, how efficient it is, and all of that. And I would urge you to look at a recent meta-analysis that looked at the privatization internationally of public systems and found that they actually had higher hospitalization rates, higher death rates, worse outcomes, and higher costs. And I think it flies in the reality is, we all think that maybe we've been, I guess, brainwashed to think that private means better, but private means that corporation is sucking as much profit out of it as they can. So that means you're losing 10, 20, 30% of the healthcare dollars to profits. They're getting sucked out. And what they find is with a lot of private systems, there's just this incredible push to understaff, and it really becomes a not good situation. Now, the reason that some of my colleagues might think private is more efficient is because currently the private sector is able to skim the cream off the top. So if you are sick with comorbidities, that means illnesses like diabetes, high blood pressure, asthma, whatever, or you have a complex problem, those sorts of patients remain within the public system and get paid for by our tax dollars. But the private system siphons off the profitable stuff, the easy stuff, scoping knees, right, for someone who has a running injury. That's not a complicated patient you're usually dealing with. You can crank out quite a few cataract surgeries, quite a few of these procedures, and get them reimbursed, whether it's through ACC or whether it's through the public system channeling money out there. And of course, that's what we're going to see in spades coming up, because essentially private insurance, the number of people seeking it is rising. And the number of private hospitals that are starting up, they're in a growth period right now because they see that the money is going to come their way. And remember, Pat, the minute you get sick at a private hospital after your surgery, I'll give you two guesses where you go, where they send you the minute you become significantly complex or ill.
They'd probably come and see you, wouldn't they? In the emergency department or something.
They get sent to the public hospital immediately. So the costs are always borne by the taxpayer, by the public sector, by the public citizens paying taxes, and the profits are always kept in the private sector. So it's a recipe as old as time.
Privatizing the profits and socializing the losses is what capitalism has done for decades to go, so to speak.
That's a better way of putting it.
Yeah, I want to show people your Substack. It's a very, very good read. Dr. garypayinda.substack.com. You've written a piece here about New Zealand's population growth. I wouldn't mind you speaking a bit to that. I know you've spoken about it a bit recently, maybe with Bernard Hickey.
No, fine.
But now you're in the big leagues. Bernard, anyway. It'd be great to hear your thoughts around the population, especially because and I do want to include in this the idea of what you seem to be saying, my word, not yours, is that this problem within the health system is somewhat systemic. Because if it's been around for a long time, that's multiple governments. Labor, they had a good chance for 3 years to do whatever they wanted to. Didn't fix it. Maybe you can't fix it in 3 years, so be it. But it seems like this can't all be laid at the feet of this current government, but they do seem to be pouring fuel on that fire. So can you talk to us about the issues around population growth, especially when it relates to the health system, and also that idea about previous governments, their contribution to where we are today?
Yeah, I think in my Substack article, I just set this analogy up of, the underfunding has been long. It's been there for a long time. I've been working here for almost 20 years, and it's always been kind of getting by on the smell of an oily rag. Essentially, it's like a car that you just keep cramming more people into. And what's different now in the past year is that you've got government essentially selling off the hubcaps, selling off the wheels, disassembling the antenna. Like, it's getting harder and harder to do the job. But I think there's a goal behind it. And that goal ultimately will probably be just like the push in the US. You realize that having come from the United States originally, I can see who Christopher Luxon is and understand that he spent a lot of time in the United States and ingrained a lot of the ruthless pursuit of power and profit that is just part of the corporatist mentality. But yeah, aside from that, there has been long-standing underfunding and deferred maintenance, but it's accelerated over the past year. So the population issue I'd like to speak to for just a minute is that this year, New Zealand is going to get about 93,000 additional people. I almost called them patients because some of them will be patients.
Yeah.
Last year, 93,000. The year before that, around 90,000. If you go back and back and back, you're looking at literally many hundreds of thousands of people just in the past 5 to 10 years. And you have to ask yourself, why isn't a government, any government, whatever one, the last one, the one before that, this one, telling us the truth, which is that we need to be building a large hospital for this population literally every year. This year, we should have had a Dunedin-sized hospital. Last year, we should have had a Dunedin-sized hospital built. The year before that, should have had yet another Dunedin-sized hospital built. And instead, we can't even maintain the ones we've got. They're the budget constraints, because again, we've given this money away to groups in society that matter more than regular patients. Mm-hmm. They say we don't have the money. And, to that, I would say you gave 2.9 billion to landlords. Take it back. 2.9 billion would give every New Zealander free dental care. It would correct the entire deficit of specialist doctors in the country. It would increase GPs by about 50%. So we would have lots of GPs, and you could hire something like 3,000 to 4,000 nurses. Would fix literally all of our atrocious understaffing problems. That's just with the 3 billion that they've given to landlords. And again, I know there's going to be friends of mine who have one unit and they're going to say, we have a batch. The tax break helps us. Fine. Carve out the poorer folks amongst them, the needy, the ones who need it. So if they need a little help, fine. But don't give someone with 300 units taxpayer tax cuts, tax breaks, and incentives to buy more investment property. It's just obscene. And so, yeah, getting back to population, last year, 93,000 additional New Zealanders, the vast majority of them by migration, inwards migration. Where are the politicians admitting the unavoidable truth that we have to take care of those people? They have to have schools, they have to have hospitals and rest homes, and we have to be building them at a fantastic rate. And nowhere in public speech have I seen any of these talking heads ever address that issue, honestly. Don't get it.
Because of that 93,000, obviously some are going to be born, but then others are going to die, but others are going to migrate here. There's going to be 15.
I think 70 to 80% of that is migration.
So let's call that 65,000 people. There's going to be 10,000 school kids in that, or whatever, 15,000 school kids, and that's bigger than any high school in New Zealand by about 5 to 7-fold. So what do we do?
So let's not even talk about the rebuild of Dunedin Hospital. That's a foregone conclusion. That had to have happened years ago, right? The rebuild of my hospital, which is tenuous at best, we're always like begging and cajoling and pleading that it'll happen. That needs to be a foregone conclusion. Of course that has to happen. Like, there was a time when New Zealand had 12 hospital beds per 1,000 citizens.
Right.
And now the number is down to 2.8.
Wow.
Come on. So yeah, we have chosen other priorities to pursue.
Well, when you say we, not we, but those guys on the 9th floor, that we.
Well, we let it happen, Pat.
Yeah. Yes.
The fact that you and I are talking about things and people haven't heard this before, that this is going to blow some minds, that they're going to have to look up the numbers and look it up themselves, and I could go on and on and on. So this is economic suicide. These politicians paint themselves as being responsible and we're good businessmen and things. This is atrocious business. The $5 subsidy for prescription drugs, like, you remember that? Like, the last government or whatever introduced it. And so my patients, when I sent them out, they would actually get the antibiotics I prescribed for them. It was free at the chemist. They would just pick them up.
Yep.
That was gotten rid of. And no one talks about the fact that the medical literature performed in New Zealand showed that the prescription drug subsidy, the free prescriptions, reduced hospitalizations by about 30%.
Wow.
Now, that's one study. You can't go building, an empire on one study, but it was a good study and a big study. And it was relevant because it was in New Zealand. It was done by our people, and it was a good study. And so if you get rid of the $5 copay subsidy, knowing that it will affect hospitalizations that badly, what can I call that except some kind of vicious, intentional, non-economic, like economically ignorant injury to the public? That's how I view it. I mean, I take all of this stuff very personally, which probably I shouldn't, but this is all very visceral to me. And I can admit that I hate what's happening. I absolutely detest what's happening. I know that thousands of people could have been saved if any part of the smoke-free legislation had been allowed to survive. Even the little bit that Shane initially supported years ago before he turned coat and went against it, just reducing nicotine in cigarettes could have helped. Reducing the number of tobacco outlets, making sure that kids can't buy tobacco and then going forward wouldn't have access. Like, all of these people are doing the most anti-public health stuff ever. And it's not about politics at that point. Like, when you're literally making policy that will kill more New Zealanders, more Maori, more, you name it. It shouldn't, it just doesn't work for me. And I think it's intolerable.
I was going to ask you a question, is what difference will Brown make? But I think with the arsonist comment at the start, you've basically said maybe he'll be a bit faster, the house will burn down a bit quicker perhaps, but he's there. So maybe this is my last question. It's a bit of a strange one because it's probably one that I would normally ask of a political pundit, but you're at the coalface. Yeah. I'm sorry, my radio days kick in sometimes and I get a bit cheesy. So if you would write a prescription for what we needed to do, like what do we need to do to push back on this? What do we, the public, the great unwashed, the voter, the ratepayer, the citizen, what do we need to do to try and fight back against this?
I don't know, man. If I knew, I would be doing it. I am just a doctor in one of the most underserved regions of Northland. Been here working for 17 years, and I don't have an answer for you, Pat. Like your answer would be better than mine. I don't know. I don't know.
When you said we let it happen, though, that's a pretty good answer. And obviously, a lot of people's minds today with the inauguration of Donald Trump, people think it's going to be great, and that's going to be a nightmare for America, an absolute nightmare. People are already losing money buying his hoax scheme, coin drops and stuff. And in a year's time, people will be saying, we let it happen. So how do we not let it happen? I always go back to what Chloe Swarbrick told us last year. We organise. We start at the grassroots. We push back. We get involved. We activate, and we try and make this a one-term government, if possible.
I mean, it sounds good, and certainly I've shown up for some of these like protests against cuts against public services and what have you. But as long as these politicians can make money from this, right? We just heard, Stephen Joyce made $1 million for assessing Waikato University and deciding that a third med school is a good idea, right? There's a lot of funny business going on. Like all of these people, Shane will probably be the chancellor of that third medical school that we don't need because we've chosen to underfund the first two that we have. It's a tiny country. We could easily turn those two med schools into something much bigger. It's a matter of priorities. And if you had put some of a tiny fraction, infinitesimally small amount of the money you gave to landlords, if you put that in Otago or Auckland Med School, you absolutely could have handled what we need going forward. No, it's not a money issue. And I'm not so confident, Pat, that marching is going to change Simeon's mind or Mr. Luxon's mind. These people are about money and power. If you affect their ability to make money or their ability to own power, then you will see change. I had a friend who voted for National this last time around. He's not super stoked about it. He's an emergency doctor as well, and he's got some issues now. But he, in total seriousness, proposed that politicians not be allowed to take private health insurance, that they have to go to the same public hospital that our patients have to go to. Yep. And I mean, I laughed. I thought he was joking at first, but he raises what I think now, thinking about it more, is actually a good point. As long as these people can live in fancy neighborhoods and have private health insurance and have private schools and never have to feel what, let's say, Northland patients or New Zealand patients have to feel. Christopher Luxon, Shane Reti will never in their lives have to wait 7 hours in a waiting room full of coughing and sick and moaning and suffering people. He will never have to do that. And I think the only thing that will affect politicians is when they have to live like regular people. And until you affect their ability to get money, so, I mean, imagine how much money ACT or national or labor, whomever, will get if they make laws that help the real estate industry, the private hospital industry, you name it. There's going to be kickbacks, whether they get jobs later on or they get campaign finance now. So it's multifactorial. Like, we've got to ensure that campaign finance is locked down and only public. In an ideal world, we would ensure that Shane and Simeon and Christopher had to go to public hospitals like my patients. But yeah, I don't know. How do you make that happen, Pat? You've been doing this for a long time. You're smarter than I am. How do you make that happen?
Well, you just remind me as well, though, it doesn't give a solution. We had Gary Economics on the other night. We didn't have him on. We played some of his clip the other night, and he talked about a recent Prime Minister from the UK whose salary was £150,000, which is quite low compared to other Prime Ministers. But his first year out of politics, he got paid £10 million to work for a company. So as a politician, when he's making decisions on policy, is he going to think about the group of people that pay him £150,000, or is he going to think about the one that's coming after? I know we don't have this kind of money in New Zealand, but that's paying him £10 million. And Gary Economics used a saying, and I probably have the paper here somewhere: we no longer have ownership of our own politicians. The oligarchy has ownership of our politicians. So I don't know how you stop that, because even if we did all the things you're saying, the first year out of politics, they could earn $10 million. Then what?
Yeah. But you know what? We have to start somewhere. And we've got to start somewhere, because if we allow them to do what they're doing, which is defunding, destabilizing, and eventually privatizing essential public services, we're really going to end up with haves and have-nots in this country, with an elite, the sort of Luxons of the world that can sell a few houses this year and raise $500,000 or $1 million. After they change the laws, benefiting from the very laws that they changed to allow it to be tax-free. So, I mean, it's multifactorial. Do we need a capital gains tax? Of course. We're letting wealthy people get away with murder here. Sometimes literally, not murder, but deaths of neglect by people who are stuck on waiting lists, who can't get in to see their cancer specialist for months and months and months. Yeah, I don't know what to say. I'm done.
I hope I haven't made you too angry and you can get to sleep tonight. You're not going to be. I was wondering, actually, when you walk into a room, is there a difference between how the people sitting in the room react to you if it's a room full of nurses versus a room full of, say, healthcare bureaucrats? Do you get a different response from each of those groups of people?
When am I meeting healthcare bureaucrats except in meetings where they tell me to shut up?
Right.
No, right. That's not the world I live in. I don't. Yeah. No.
Yeah.
No. When I walk into patient rooms, the really crappy thing is to have to immediately say, "I'm sorry that it took me 4 hours to see you," or 5 hours to see you. That's the crappiest part of it.
Well, listen, I haven't put a lot of them up, but the chat's been going crazy for you. They love you to bits. Our regular messenger, Arsehole, says, Dr. Payinda says it all. I could listen to this guy all night, and that goes on and on and on. Where's the other ones? There's down the bottom here. One here. Kiwi Bird says, hi, Dr. Gary, big fan of your work. We've got Brian Turner who says Brown will crush the public health system. I guess what we're saying, and what the chat is unanimous in, is we love what you're doing. We really appreciate you, and we want to keep speaking to you. Unfortunately, for an awful reason, but if we're not talking about it, then no one is, Gary. And they can get you on Substack, and I want to have you on here more if you're wanting to come on. And I guess I'm just going to say now, thank you so much for our 10 to 15 minute chat that's lasted 35 minutes.
You're most welcome. I'm happy to talk about this stuff to anyone, with anyone, one-on-one or on a podcast. It doesn't matter. The only thing that matters is that we create a better community and a better society and a better New Zealand. And one of the ways you do that is by collecting taxes and using them for the things that matter. And essential public services, education, like nursing, police, even like the Defense Force, things you might not think about, like have all been damaged under the sort of austerity privatization scheme that's been going on now for the past year. And I'm not sure that things are going to be okay after 2 more years of this. And we know that Simeon has no health. His name's Simeon, right? It's not Simon, right? It's Simeon.
Simeon.
And we know that Simeon has no health experience, very little real world experience of any kind, has done some atrocious things with the speed laws, essentially turning a deaf ear to all the public health. We have trauma surgeons telling you that when other countries like UK dropped their speeds from 40 to 30, they reduced fatalities by, I think in the UK it was like 42%. But it's in that realm of an incredible difference in terms of broken and injured and dying and dead people prevented by these small changes. And we've got this absurd politician saying that it's going to increase productivity so massively, to get to work 93 seconds faster. It's just, it's beyond belief. And we can talk about it more some other time. I could keep going on, but me talking about it doesn't change Jack. And I don't know that marching changes it. We've got to come up with ways of affecting these politicians in terms of power and money, because that's the only thing that matters to them. It's the only language they speak. And whether they trade out one for another, Shane for Simeon or vice versa, irrelevant. What matters is we've got to preserve the things that make a society better. And public health care and primary care and elder care, public schools, these are important things. They're beyond important. They're critical.
All right. Gary, thanks so much for being so generous with your time tonight. Always enjoy having you on, and love to have you back super soon.
You're welcome. Talk soon,
right.
Pat. Bye-bye.
Gary Payinda.